I believe, I'm a Christian, so I believe that everybody is made in God's image. And I really want to just enhance that God-given beauty. I think the inner beauty is more important. If you could do work to your face all day long, and if you're not beautiful on the inside, it doesn't mean anything. But like we talked about, it isn't vanity to invest in yourself. It isn't vanity to just want to put your best face forward or best foot forward. And so it's important to me to help people do that.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Hayley Lovett, who began her nursing career early, becoming a certified nurse aide in high school. Her diverse clinical background includes corrections nursing, sexual assault nurse examiner in forensic nursing, and other hospital floors such as orthopedic and spine, pediatric, oncology, critical care, and more as part of a float pool. She also brings leadership experience as a charge nurse, preceptor, and clinical nurse coordinator. In 2019, Hayley pursued her passion for individualized care, aesthetics, and wellness, beginning her journey as an aesthetic nurse and completing exhaustive advanced training. After moving from Colorado to Omaha in 2022, she now specializes in injectables, energy-based devices, lasers, microneedling, and regenerative medicine. So Hayley, welcome and glad to have you here.
Thanks so much for inviting me. I'm excited.
Yeah, so let's start off with this, Hayley. How did you first get interested in the medical field as a whole?
Gosh, yes. So I've been a nurse for about 10 years, and like I said, I knew I wanted to do something to help people very early on. I originally thought maybe like physical therapy or something, but throughout high school, I was led to the nursing path from a couple of my grandmas who were nurses and in the medical field. And they were like, you know what, just get your certified nurse's aide, see if you at least could do that or, want to um, kind of dip your toe into that, see if you like it. And then I just fell in love with helping people. I knew I wanted to pursue my nursing degree, and have had various different experiences through nursing, which I'm grateful for. So yeah, it's been a great path.
Okay. And what was it, I guess, what was the starting point of when you decided to transition into aesthetics?
Yeah, so my mom and her twin sister actually owned a laser hair removal clinic
Mm-hmm.
growing up, and I never actually even considered it, surprisingly. I always just thought I would work at the hospital. And one day my aunt was like, do you want to maybe get trained in Botox or just a couple things that you could do for us every now and then? For the family personally, but also their clients. And I intended to just kind of do it on the side. It sounded interesting to me, but then once I got the initial training, I just realized how much more there is to it. So, the training itself is expensive, and I wanted to put my all into it. But also, I just realized there's way more to it as far as like anatomy and safety and just getting good outcomes and really, you know, putting your best foot out there with it. And I just knew that I would need a lot of repetition. And so I just didn't feel like I could do it on the side. And I became more and more passionate with it. And so, yeah, I just ended up being like, you know what? I'm gonna leave the bedside at the hospital and make the move. And it's been great.
Yeah, it sounds like you're where you're supposed to be.
Yes, exactly.
Okay, so now that you're at Bare Body Shop, I want to talk about some of the common treatments that clients come to you for. You talk about some of the most common, most popular treatments that clients come to see you for.
Yeah, gosh, we're kind of all over the place, but I love it because we have such a variety. Um, I would say microneedling is very popular. We have our injectables like Tox and fillers and Sculptra that are very popular. A lot of lights and lasers like our broadband light and Moxie are super popular for pigment. And then we actually have a new device called Fotona that has been super popular. We rolled that out about a year ago, and there's all sorts of different treatments on that for the lips, the eyes, the full face, and even snoring, like some other random treatments like that, but just to promote overall health and wellness. So I'm liking it. Yeah.
Got it. Now, I want to dive a little bit deeper into the multimodal. And I think my multimodal is just so people understand, is basically doing different treatments on one person to achieve different goals. So, can you talk a little bit more about that? Like, what's the benefit of doing multimodal versus just one treatment?
Gosh, it is important to try to do a multimodal approach. And a lot of education goes into consults to explain this to patients because they oftentimes don't know about all the underlying things going on under the skin. But we're able to hit different layers of the skin, target different problems just to overall look better. So, maybe we're filling with filler to restore the volume in the face where the fat pads are decreasing. And then we're using some toxin to minimize the muscle movement. And then we're doing some sort of laser or microneedling to address the skin quality. And so you have all these different layers to the face, which is what you learn with all this anatomy, and you have to then educate the patient. But it is important to address all those different things for the best result. And I do like that we have so many different treatments to offer because you are able to tailor it to the patient more, as far as what you physically assess what they need, but also just their lifestyle. Like some people come in and they're like, I really don't have a lot of downtime. I am very busy with my work and everything. And so you're assessing that, or you're assessing their pain level, pain tolerance. And so you can pick out the treatment that you think is going to work for them the best and give them kind of a custom tailored treatment plan.
Okay. Now, for people who have never done any type of multimodal type of treatment, and maybe there's some hesitation or some fear, kind of how do you walk people through that? Uh, like, especially if you see that the multimodal treatment can actually help them and get to their goals.
Yeah, like I said, education is super important. If you're not trained in this stuff, you don't know. So it's just all about education, and just building that trust and rapport. And I like to kind of bring them on a journey. I don't like to just throw all the options at people all at once because people just get overwhelmed. And in the Midwest, we tend to be a little bit more conservative, as practitioners, but also the client is tends to be more on the natural side, slower, um, getting into the process. And so just kind of building that trust, I think, goes a long way in meeting people where they're at. Um, and then once they start to trust you as the provider and see, improvements in their skin and they start to get excited, then you can kind of start introducing things little by little.
Okay, so sometimes it's they're gonna get there eventually, but in the beginning you may just start off with one treatment, and then once they're comfortable, okay, let's add another one in, then add another one in, and that helps to ease them into the entire treatment process.
Right. It's like you can kind of gauge depending on the patient, but because I do like to set people up for, a long-term plan. Um, so they know what's coming, but sometimes, you do have to go a little bit slower, meet people where they are, and not come off too salesy. Just,
Mhm.
okay, we're going to start off with this and then we'll reassess in a couple months.
Okay. So, and what are some of the most common misconceptions people have about the multimodal treatments, that is just not correct or that they believe is to be the case, but it's not really the case? What's some of those most common misconceptions you've heard?
Yeah, so I would say one of the big ones is by doing a multimodal approach, you're going to start looking overdone because you're doing more and more.
Mhm.
Um, I would say it's very hard actually to look overdone or fake. If you trust your provider and you're going slow, a lot of this stuff takes a long time to start working too and stimulate your own collagen. And it's hardly ever going to look overdone. It can get there, but if you trust your provider, I would just trust that they are taking you on the correct path. By doing more, you're not going to look unnatural or fake. You are just addressing the problem or what bothers you from different levels.
Okay. Okay. So then that's the multimodal side of it then. Another thing that I understand that you guys do is vaginal rejuvenation. So for that, I know the service out there, but I don't think I've ever had anyone on the show who's really kind of like gone into that in a deeper sense. So let's talk about that. What is vaginal rejuvenation from a high level view for people who've never heard of it? I think a lot of people have never heard of it.
Yeah, it's not often talked about, but it's a very common issue. And we're not just focused on looks, we're focused on just overall health and wellness and function and relationships and everything. So that's kind of what I first got started in, actually, over even Botox or anything. I started doing PRP shots, so platelet-rich plasma. And that is from a blood draw, if anybody hasn't heard of it, but you draw your own blood and you spin out the plasma, and that is going to be all your body's healing factors and all that nutrients from your own blood and your own body. And so you can actually inject it into the vaginal wall. We also have devices that stimulate collagen and heat up the tissue for tightening. It's really good for incontinence. So if any moms out there are, oh, I'm jumping on a trampoline with my kid and I pee a little bit, that's like a very common problem. So,
Hmm.
or you sneeze, pee a little bit, any sort of incontinence like that. Um, Moisture, just overall feeling and function. It's a game changer for a lot of people.
Okay. And is it something that's typically done for women over a certain age, or is it really going to be, can it be kind of across the board when it comes to age range?
Gosh, yeah, I feel like most of our clients are maybe like past 50, just with normal age-related changes. Everything, our face, everywhere gets more lax, and we lose collagen, we lose elasticity. So you start to see those age-related changes, and with hormones like perimenopause, menopause, but also even just some of the younger clients who have had kids, and everything is just kind of different. So yeah, kind of a wide range.
Okay. And is something where it's almost like you're built, I guess, to try and think of it like another way, like you're almost kind of like building the muscle back? Or is that kind of like what it does? Like from a, I guess I'm trying to come up with like a simplified example of kind of what it's like.
Yeah, so it heats up the tissue, kind of similar to some of the face treatments where we use radio frequency.
Hmm.
So it is stimulating that deep tissue and heating the tissue to stimulate collagen and elastin. And so you get kind of a tightening effect from all of that. Kind of same thing. We have the Votiva machine with InMode, and the equivalent to the face is the Morpheus, or the Forma, and so you're using that radio frequency energy to tighten here, and you can also use it for vaginal rejuvenation.
Okay. And I've heard of the treatment called the O shot. Is the O shot the same as vaginal rejuvenation, or is it like a subcategory under vaginal rejuvenation, or like how does the O shot play a role in all this?
Yes, so actually the PRP injections are the O shot. I originally trained with that doctor who kind of trademarked that, and so you can only call it O shot if you are like under his training and under his I don't know what it would be called. But yeah, if you can just call it like PRP
Mhm.
rejuvenation or vaginal rejuvenation if you're not directly under him, but it's the same thing.
Okay, got it. Now, for this type of treatment, what are some of the common myths that you've heard about this? So I'm sure a lot of people come in like probably more for this one than the multimodal was like, hey, like, what is this? I've heard about this. Does it do this? Is like, so I'm assuming there's a lot more myths and misconceptions about this treatment, but what are some of those common ones that you've heard?
I think one of the common ones, and this actually is with any treatment, is just that you can have a one and done fix.
Hmm.
So whether it's vaginal rejuvenation or a face treatment or any, I have some lines and wrinkles, whatever. A lot of people just think, okay, do what you're going to do, and then I'm going to be fixed. But we have to remind people that you didn't get this way overnight. You didn't get a wrinkle overnight, or you didn't lose all the elasticity in the vagina for, overnight. It took a lot of different factors and years. So give us some time, be patient. We will improve things over several months, with several treatments, and just kind of go on that process with us and be patient.
Okay. And on average, about how many sessions would people need to get of this before they can start to see noticeable results?
I would say usually about that third treatment, people are starting to notice improvement. And then, we usually recommend about 3 to 6 treatments before reassessing. Some people need more. Um, but around that third one, after a few months, we kind of space them about a month apart.
Okay.
People are starting to notice a difference in maybe their sex life or just the dryness or the incontinence.
Got it. Okay, now let's say that somebody is searching for a provider who can provide these treatments that you just talked about. But let's say they don't know anybody, and they're trying to find a provider that can do the job correctly, can help them hit their goals, and that they can just really help them. What advice would you have for that person as they're doing their search?
Yeah, that's a good question. Well, if you're in the Omaha area, come hit up Bare Body Shop. But other than that, I would just say be very diligent about your research. Start with a simple Google search, ask around. It's kind of a less talked about treatment as far as when you're asking your friends and all of that. But if you can you start to research the providers, look into their training, look at their Instagram and everything like that. Reach out and ask questions and do your initial consult, maybe with a few places. And when you find a provider that you trust and they've talked about all their training and they have made a treatment plan for you and you're comfortable moving forward, they answer all your questions without being salesy or pushy, then yeah, I would just trust them, not bounce around too much, and just pick one provider that you will go on this journey with.
Okay, great advice. What's some red flags that you'd say people should kind of keep an eye out for? Like if you see this, then maybe you want to keep searching.
Ooh, I would say um sales are kind of hard. Some people say, oh, if anything's ever discounted, then that's a red flag. I don't agree with that. People are always looking for a sale, and um, a lot of times it's a good way to reward your established clients or bring in new clients by offering a little bit of a discount or something. So that in itself isn't a red flag, but if the price is too good, it's probably too good to be true, kind of the Groupon situations. Um, I would say if you are at an initial consult and maybe they don't talk about their training at all, or it does feel very salesy and pressury, just, maybe that's a red flag. You really do want to just trust that the provider is ethical and has your best interest as far as what's going to work for you, and trying to get to know you as a person versus just pushing something on you, any sort of treatment just to make a sale.
Got it. Okay. Now, Haley, in what you do, what role do you believe creativity plays in how you approach your patient care? Because I think people, especially like when you're working like in the hospital setting, creativity is not something that people are looking for from you. It's like just give me the treatment, like follow the protocol. But with what you're doing with the aesthetic side, what role do you think creativity plays?
I think it really does come into play. It came into play a little in the hospital, but it was more, you just taking the extra step to make a patient feel, comfortable or fluffing their pillow or getting them their coffee that they like.
Mhm.
But in aesthetics, it really is, you can tailor the treatment to that specific patient, um, more so than the hospital, like you were saying. So, especially like asymmetries, for example, I have a couple clients who, they're not being too nitpicky. I watch for that, but maybe they had a surgery on their face or one of them had a dog bite on their face, and we just have natural asymmetries too. And they just kind of want to balance everything out. You can be very creative with, okay, I'm going to put a little bit of tox on this side and not this side, or a little bit more on this side, and try to balance those facial muscles. And also being creative with just the timeline. I have a lot of people who are either getting married in a year or maybe they're snowbirds and they go to Arizona or Florida and I don't see them for half the year. And so I'm trying to be creative with the timeline. Okay, I have this many months with you. What is going to be our best case scenario? Like, how do I get in the biggest bang for our buck as far as treatments, and scheduling what, when? So I really enjoy that aspect of arranging everything too.
Okay, got it. And and when it comes to artistry, how important is it to have an artistic eye in what you do?
Yeah, it really is. I've heard people say, kind of a balance of the art and the science, and it really is. You do kind of have to have that natural artistic eye, I feel, but it can also be trained because things that I didn't see originally with facial assessment and balance and proportions and all of that, I have trained myself to look for certain things. And even just as I'm talking to people, I'm not nitpicking them apart or anything, but I am able to see how their face moves and what muscles are working and what features really stand out to me. And that comes a lot more natural with practice. And so you kind of have to have it, but you can also work on it and balancing that science. Okay, we know facial anatomy, we know injection depth, we know all of those things, but then balancing it with the art, and not every face is cookie cutter, and we don't want it to be.
Yeah. Okay. Got it. Now, Haley, throughout your experience, I'm sure that you've run into some memorable cases or challenging cases. Is there maybe one story that comes to mind that you can share? Again, a memorable case, a challenging case, and how you were able to get them a great result in the end?
Yeah, gosh, I have so many great clients. One that kind of sticks out is I had a lady in maybe her 70s, and she came to me, and I could just tell she was kind of down. Her shoulders were slumped. She said she didn't love to look in the mirror anymore. Um, she, was a sun tanner for a lot of years, smoker for a lot of years, had a lot of pigment, and she was just like, is this too far gone? Like, she called herself an old lady. I'm like, you're not old. But I got a really great result with starting out with even just a broadband light and a moxie. It was kind of one of those things where she saw an instant improvement in her skin, in the pigment and the sun damage. Her neighbors were saying she looked just brighter. Um, and she just told them she got a facial, which is fine. But even just that little bit of confidence I gave her with that one treatment, and then she trusted me to continue. Maybe we start some Botox, maybe we do a few more lasers. Um, so that case really sticks out because I could just see that she was more confident, and that's really what I am going for. I'm never trying to change how somebody looks. Um, I really just want people to feel more refreshed and less tired, or, just like the best version of themselves, and giving them that confidence really means a lot to me.
Yeah, I think the confidence is a big part of it because when people think about aesthetics, they think, oh, it's about the vanity portion of it, but it's rarely that. It's just people want to get their confidence back, and they just want to be the best version of
Exactly.
themselves.
Right, exactly. Best version of yourself. I'm never trying to make people look like a cookie cutter, fake person. I just want you to look more confident and invest in yourself, look a little more radiant, glowy. And I feel like, studies have shown this, but we know intuitively, just with common sense, that if you feel more confident and you feel better about the way you look, you're going to go into the world better. You're maybe at your job or in your family, or you're going to be more open to connection with a stranger, or try something new. It's just going to have ripple effects.
Mhm. Yeah. So then, Haley, where do you think the future of aesthetics is going?
Gosh, there's always something new and everything's always changing. I would say people are focusing more on that natural result.
Mm.
For a while, it was, maybe the overfilled lips, and maybe it was starting to look a little overdone. Now we're kind of back on that natural trend, which I love. So, focusing more on those natural collagen-inducing treatments like microneedling, Sculptra, and just tasteful injectables. So you can still do the Botox and filler, but we're just doing it in a more balanced and natural way. I also think that regenerative medicine is coming into play and, more PRP and peptides and all of that kind of stuff, just so that we are healthy from within as well. Um, so yeah, there's lots in this industry and it's ever changing and you don't want to follow the trends too much. You want to stick with what's tried and true, but also be open to everything that's new.
Yeah, I get that. Well, now with that in mind, for Bare Body Shop, what's the vision for Bare Body Shop?
Yeah, so we really focus on just the patient experience. So always holding true to that, even if we are implementing something new. We do have a lot of new devices and treatments. So one of them is the Fotona laser that we got. We are seeing great results with many different treatments that we offer with that. And we are always open to bringing on something new, but then also holding true to the core values of teamwork. We have a really great team. We all get along really well. And then just the patient experience, like we are all about creating that patient relationship. We are all about just going the extra mile. Like we send cards to our patients if they had a death in the family or they're getting married or something. We just want to be there for them. And so holding true to that too.
Got it. Well, Haley, I have one last question for you, but before I ask it, I do want to point people to your website at barebodyshop.com. Now, last question for you, Haley. What does beauty mean to you?
Oh, that's such a good question. I could go on and on. Beauty comes from within. I believe I'm a Christian, so I believe that everybody is made in God's image, and I really want to just enhance that God-given beauty. I think the inner beauty is more important. If you could do work to your face all day long, and if you're not beautiful on the inside, it doesn't mean anything. But like we talked about, it isn't vanity to invest in yourself. It isn't vanity to just want to put your best face forward or best foot forward. And so it's important to me to help people do that. People want to age gracefully. I don't like the term anti-aging really. I still use it because that's just kind of what people say and what they know what you're talking about. But it's a privilege to age. It's a blessing to age. And I think if we can just help soften some of the harsh effects of that, then that's kind of my goal is just giving people confidence and being super ethical with it, and not playing on people's insecurities, just really focusing on them as a whole. And so, yeah, I could go on and on, but I think, beauty's from within and beauty is how God made you.
Awesome. Well, there you have it. Sharing your expertise. So, Haley, where can people contact you in your practice?
Yes, so you gave our website. We are Bare Body Shop on Instagram at Bare Body Shop, and then I am Hayley Ray Aesthetics, so HayleyRae Aesthetics. Finish that. And that's me on Instagram, so you can always message me, and I will try to get back to you as soon as possible. And I'm always open to answering any questions anybody has.
Awesome. Well, Haley, this is great. Thank you for coming on. Thank you for sharing your knowledge and thanks for sharing your message.
Yeah, thank you so much for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.